treating symptoms without addressing the underlying cause is like putting a Band-Aid on a wound without cleaning and disinfecting it. It might temporarily provide relief, but the root cause of the issue remains unresolved, and it can potentially get worse over time. Just like treating the symptoms of a disease may provide short-term relief, but it often fails to address the underlying factors that contribute to the disease's development. By focusing solely on symptoms, we miss the opportunity to identify and really address the causes that are leading to the cycle of reoccurring symptoms and incomplete healing. In contrast, if we address the root cause of a health issue, it allows for a more comprehensive and effective treatment. And that leads to long-lasting improvements in our health and well-being. It's like fixing the foundation of a building to ensure stability and structural integrity rather than just repairing superficial damages. That is, in a lot of cases, the difference between a holistic or functional medicine practitioner versus a lot of modern day approaches to medicine. And that's not to say that all doctors or pharmaceuticals are bad and don't fix issues. Like, that just is not true. However, a broader approach certainly can catch things and can fix things systemically that a lot of just the way that the medical system is set up is just not prepared to catch. And my next guest, Sarah Baker, is someone who is focused on holistic health practitioning. She's an integrative nutritionist and coach that helps clients uncover the root causes of their health challenges and guides them through an approachable nutrition, health, and lifestyle blueprint that is unique and easy to sustain. I have a really interesting conversation with Sarah, and we dig into some practical approaches to addressing some very common health challenges, including stress and burnout. Well, hi, Sarah. Thanks for being on the show today. Appreciate it.
Thanks for having me, Jacob. I'm really excited to chat with you.
Yeah, likewise. So you're in Chicago, and we've been sort of messaging on Instagram for a bit about digging into this topic of holistic healthcare, functional medicine. For those who are, not really like in the know about this approach to health and wellness, can you share and explain what functional healthcare is and how does it differ from traditional healthcare?
Yeah. So, whenever you're working with a functional health practitioner or even a functional medicine doctor, the approach is like literally the opposite of conventional medicine.
Okay.
So, when you go to a conventional medicine doctor, that's billed through insurance, which is awesome. That's why you have insurance, but your doctor can only spend around 15 minutes with you, and they typically run over symptoms, and then the result, or not result, their suggestion for whatever symptom you are presenting to them is typically a pharmaceutical drug or a referral to a specialist or a referral to somebody else. But in the end, a lot of people kind of hit a wall because their solutions is typically drugs or pharmaceuticals, which in a lot of cases is very necessary and even life-saving if you have like cancer or diabetes or any sort of serious illness or disease. So for any listeners that are dealing with something serious, I would 100% recommend blending conventional and functional medicine together, where you work with a conventional doctor and you work with a functional practitioner. How functional health and functional medicine is different, many different ways. So we work from a root cause approach. So let's say somebody comes to me with like late onset type 1 diabetes or just, type 2 diabetes, and they are working with a conventional doctor. Functional health practitioners typically will meet with you for about an hour to go over like lengthy health history, and a lot of questions that a conventional doctor wouldn't ask, such as, what are you doing for work? How long are you working? What's your stress like? What's your sleep like? Have you ever lived in a water damaged building? Like a lot of strange questions that the client or the patient would think is like, why are you asking me this? But we ask all these strange questions because we're looking for a lot of what is called like hidden stressors to current symptoms, current health
Mhm.
conditions, and even a lot of illnesses, especially autoimmunity. I see so many clients that have autoimmune issues. And so functional medicine recognizes that there's typically root cause or a hidden stressor or conglomerate of different hidden stressors that kind of work together and create the perfect storm for an illness or a health challenge or an imbalance. And so, what we target then are those hidden stressors and not the symptoms. If we were to target just the symptoms, maybe you would feel some relief, but it's essentially a band aid and it's not addressing what is causing your health challenge. And so then once we kind of uncover what the hidden stressors are to the whatever health challenge you approach us with, then we create a completely systematic type of
Mm.
protocol that does encompass strategic supplementation as needed, but really, really prioritizes strategic personalized nutrition, at-home detox therapies, because typically if you've got a health issue, you've got a detox. And it's not the type of detox that you think where it's like a juice cleanse or, you're starving yourself for a few days. It's not like that. And then we address a lot of like nervous system regulation because one thing that leads people to conventional doctor is chronic stress. Chronic stress is typically the number one cause of any type of health imbalance because you want to look all the way upstream to what causes, metabolic issues that can manifest into illnesses, disease, health challenges, whatever, and it typically stems from stress. So, long story short, we spend a lot of time with every client. We do a lot of sleuthing. We're like detectives to figure out what is actually causing your
Mm.
symptoms. And then we spend hours creating protocols and plans for every single client where conventional medicine, they're with you for those 15 minutes and then that's it. Bye bye. See you in, like 2 months.
Yeah, that's really interesting as far as the approaches and the differences in how you're approaching these. Um, I want to dig into some of that a little more because um, there's a lot of information there, and for those that are like not quite how do I want to say this? I want to make sure that we're really understanding the difference between the upstream and the downstream approach. So,
Mm-hmm.
uh, when we're talking about a situation where someone comes in and they have symptoms, they are facing specific challenges. The traditional approach is to go to a doctor and to have those challenges treated. And what I hear you saying, though, is we may not necessarily be addressing the underlying issues.
Mm-hmm.
And so understanding holistically how all of the factors that someone is experiencing in their lives are affecting how they're feeling. Uh,
Mm-hmm.
so the question that comes to my mind is how do you, because when I think about my life and I think about all of the possible things that could be contributing, could be affecting the way that I feel at any given moment, it's like, oh my gosh, that's overwhelming, right? When I think about like physical health, mental health, relational health, my environment,
Mm-hmm.
that I'm in. I mean, there's what I'm eating, right? There's so many factors that go into that. So how do you start to understand how those interplay? Because I mean, I would imagine it gets complex very quickly when you're trying to understand the intersectionality of all of those factors.
Yeah, it does get very overwhelming. And that's why anybody that's on a healing journey gets very overwhelmed very quickly. Because if they go on Instagram, they see people saying, oh my gosh, you need to get osmosis tap water because there's parasites in your tap water. Or, oh, the air you're breathing is infiltrated with mold spores from outside or in your house or whatnot. And oh my gosh, if you're working at a computer all day, you're getting EMF. So there's like always a bombardment. And yes, we live in a toxic world, but instead of getting overwhelmed about everything that we're coming into contact with, the two priorities that you want to kind of focus on and prioritize initially in your plan is nervous system regulation and sleep. Because if you have a dysregulated nervous system, meaning let's say you are like a CEO of a company and you're in back-to-back meetings every day, you could barely take a break, you have a very high demand job, and then let's say you have to come home and manage your family time, your nervous system is always on high alert. It's always scanning for the future and trying to anticipate what's going to happen because
Right.
your nervous system also wants to protect you. It wants to prepare you for what could happen in the future. And so we call that like sympathetic dominance, where you're just always kind of on, or scanning your environment or anticipating what's going to happen in the future, where you can turn that off and turn on your calming part of the nervous system, the
Right.
parasympathetic nervous system, where you can feel safe. And so a lot of people will say like, okay, I'm working on my root cause. All right. Okay, let's use an example. Somebody has Hashimoto's, which is autoimmunity of the thyroid. They go to a conventional doctor. They prescribe them thyroid medication like Synthroid. And then they come to a functional health practitioner. The functional health practitioner runs a bunch of functional labs, does different assessments, and they find out, oh, you have, like gut dysbiosis, which is a gut imbalance of the bacterial flora, or you have leaky gut, or something's going on in the gut. And one root cause for Hashimoto's is leaky gut or gut dysbiosis, but there's many other causes, like mold could cause it, parasites could cause it, chronic stress because of the HPA axis. Again, there's a lot of different causes. But let's say they uncover a lot of the contributing causes, and this person is taking all the supplements and going on like a gut cleanse and doing detox protocols at home, like castor oil packs and whatnot. But then she's not managing her sleep. She's not managing her stress. She's in a very high stress job. She's juggling work and kids and family and her own life. And her nervous system is on high alert. Or let's say she has trauma in her past that she hasn't addressed, because that's also a big roadblock
Sure.
to healing yourself is trauma. Or you just don't feel safe in your body. Let's say you have like a chronic, health issue that you think about all the time. The first step to any healing plan is feeling safe in your body and learning how to regulate your nervous system. And sometimes that requires people to make uncomfortable changes, right? Maybe sometimes, and of course, not everybody has the privilege to change hours on their job or find a new
Sure.
job or change those aspects of their life. Others do have the benefit of being, well, you know what, I'm going to go on like a sabbatical for 6 months to focus on my healing or whatever. Everybody's circumstances are different. But what we can all work on is regulating our nervous system. And typically that requires like somatic practices. There's only so much like talk therapy that somebody can do if they don't feel safe in their
Right.
body, because those deep emotions of not feeling safe or dealing with trauma, that's very somatic, meaning that
It
it's
lives in your
physically
body.
within the
Yeah.
body. So that's what I think is the priority, is working on nervous system regulation and sleep. Because if you are not sleeping well, you're not giving your body what it needs in order to turn on all of its healing mechanisms.
Yeah.
So I would say those are the two first things you want to master. And then your body will create this resilience where it can eradicate, parasites that you come in contact with. It can build a robust immune system so that if you do have like acute mold exposure somewhere, your body can detox it. You can methylate, you can detox, you can eliminate, and you can withstand all of our environmental toxins that we come in contact all the time, especially EMFs, because we have a really strong terrain that can be resilient against life's ups and downs.